Bismillahirrahmanirrahim. Dear students, welcome to my lecture number 39. Today I will teach you about the angiotensin receptor blockers. So what are angiotensin receptor blockers? Angiotensin receptor blockers are those agents that act on the angiotensin type 1 AT1 receptors. Angiotensin receptor blockers includes Losartan, Valsartan, Candesartan, Ebrosartan, and Telmisartan. Now there are some unique features of angiotensin receptor blockers from AC inhibitors. So these are the agents which are unique from the angiotensin converting enzyme inhibitor, as that they don't have effect on the bradykinin and they cause more complete inhibition of the angiotensin action, because beside angiotensin converting enzyme, other enzymes they are also present which can angiotensin 2. So pharmacologically that is vasoconstrictor. Now come to our Losartan. So pharmacologically, the mechanism of action or mode of action of Losartan, actually it causes antagonisms in the angiotensin receptors, thus causing a complete blockage of angiotensin 2 activity, because our main target is to block or to inhibit the activities. Whenever there is occur vasoconstriction, so in order to control and minimize that condition, so potent vasodilators and many more agents they are used like. So Losartan, the pharmacokinetic of Losartan is they are orally administered drugs. It can be orally administered to the patient and they are extensively metabolized. Their metabolites retain activity. Its plasma life is 2 hours. It must be noted the plasma half-life of Losartan is 2 hours. The dose for Losartan is 50 milligram per day and it can range from 25 to 100 milligram per day. Clinically, the Losartan they are recommended for hypertension, high blood pressure, and the adverse effects which are reported by the different literature similar to AC inhibitors, except that no angioedema and cup is present, both of which are mentioned by bradykinins. This point should be clear that angiotensin receptor blockers, so they are contraindicated in pregnancy. It cannot be used in pregnancy. Sertraline is an analog in competitive inhibitors of the angiotensin 2 at its receptors. It also blocks the pressure and aldosterone releasing effect of infused angiotensin 2 and reduce the blood pressure in high renin activity states such as renal artery stenosis. It is being withdrawn from the market due to its unpredictable pharmacological outcome. Now come toward the vasodilators. So this is another group which is used in the treatment and the management of hypertension. So vasodilator include the following drugs. The first one is oral vasodilators. So the drugs which can be given to the patient orally, that is hydralazine and minoxidil. It means they are orally available. While the second one is parenteral vasodilator. So parenteral vasodilator include sodium nitroprussides, diazoxides and phenoldiphane. The mechanism of actions or mode of actions of this vasodilator. So this class of compound causes the dilatations of the arteries of both arteries as well as veins, and thus it reducing the overall parenteral resistance and in turn decrease the blood pressure. Hydralazine, it is a hydralazine derivative and it is also known as dilate arterioles, but not the veins. It causes tachyphylaxis to hypertensive effect develop rapidly and it can be used in a combinations. The pharmacokinetics of hydralazine is it can be given to the patient orally, and this drug is extensively metabolized, the first pass of metabolism, so this is extensively metabolized almost all the drug they are metabolized in the liver. So liver is the major organ which is responsible for the metabolism. And hypertension at his low bioavailability and its half-life is 2 to 4 hours. As I have already discussed about the plasma half-life, that this is the time which is required for a drug to achieve the peak plasma concentration to be reduced 50% half of its original concentrations. The normal dose which is required for the hypertension, so the dose can be given especially that is 40 to 200 milligram per day. These are the adverse effects which are reported by the literature, different literature reviews. So hypertensions, these are the adverse effects. Headache may be occurs, nausea, anorexia, loss of appetite, palpitation, flushings, and systemic lupus erythematosus. These are the autoimmune disease, so you can study in physiology. Minoxidil. So this is another agent which is used in a treatment of hypertension, in the management of hypertension. So minoxidil is also vasodilating agents, and minoxidil, it is orally active and its half-life is 4 hours. Its dose is 5 to 10 milligram per day in 2 doses and divided doses. While it is actually potent vasodilators, and vasodilatation result whenever there is occur vasodilatation, so as a result of there is occur opening of the potassium ions which bring the membrane to hyperpolarized state and produce relaxation. Minoxidil, they are also available in topical form and solution form, and this drug is also used in the treatment of malpatent baldness. So orally, this drug was recommended for different patients, especially in order to treat the hypertension. But this drug was used by especially female hypertensive women, and after that, hairs appears on the body of the female. So after that, this was proved that this drug is also used in the treatment of male pattern baldness, because this drug was formulated in the form of solutions, and that solutions you can directly apply especially on your head regions. So now this drug is also minoxidil. It is available in a market by trade name Regans, and now it can be recommended topically, and this drug is primarily used for the treatment of male pattern baldness. It also dilates the arterioles but not the veins. There may be chances of these are the side effects which are reported here. So it may be in the form of headache, sweatings, and hypertrichosis, tachycardia, angina, edema. These are the side effects. Phenyldopham, this is the another agent, so it is indicated for the severe hypertension and postoperative hypertension. It acts as a dopamine D1 receptor agonist, as the resulting dilatation of the peripheral arteries can occur, and it can be also given parenterally in the form of IV intravenous infusion and extensively metabolized, and a very short half-life of 5 minutes. A very small dose of almost 0.025 to 0.05 microgram per kg per minute. So this is the recommended dose. This is very small dose. Individualized care approach of calcium channel blockers. So calcium channel blockers, they are suited for these conditions, and it should be avoided especially in these cases. They are suited for the elderly patients. They are suited for the isolated systolic hypertensions. It can be used for the asthmatic patients and as well as chronic obstructive pulmonary disease patient. They are also indicated and suitable for the rhinite disease, migraine, as well as especially during pregnancy, whenever a female and she has hypertensive. So for pregnant hypertensive patients, this calcium channel blockers can be used. They are suitable. While the calcium channel blockers, so they are avoided especially in CHF, congestive heart failures, and they are also avoided in conduction defects and the patient receiving beta blockers. Those patients who are receiving beta blocker like propranolol and atenolol, so as we know that beta 1 is the most dominant receptor which is present in the heart. So they are also calcium channel blocker. They are also avoided in ischemic heart disease as well as in post-MI myocardial infarctions. They are also avoided in left ventricular hypertrophy, and male it causes enlarged prostate. So especially in male, in case of male and who have his prostate, so it cannot be recommended, and there are that it cannot be this drug calcium channel blocker. They are also avoided in GERDs, gastroesophageal reflux disease. Now come to our AC inhibitor. So they are also suited for angiotensin converting enzymes, captopril, enalapril, lisinoprils. They are suited for high renin cases or those on low salt, or they are suited for physically active and especially diabetics with nephropathy and coexisting angina and post-MI cases. While the AC inhibitor, they are also suited for the coexisting left ventricular failure and left ventricular hypertrophy, and they can be also suited for the gout, especially for the gout patient whenever there is accumulation, abdominal accumulation of uric acid in the joints. So the parenteral, they are also suited for the peripheral vascular disease and dyslipidemic patients. AC inhibitor, it should be avoided in bilaterals, renal artery stenosis. They are also avoided especially in case of pregnancy. It means that AC inhibitor, captopril, enalapril, lisinopril, they are not recommended especially during pregnancy. So this drug can be used with precautions, and it cannot be used during hyperkalemia when their potassium level is high in the blood, and they are also avoided in pre-existing dry cough. Beta adrenergic blockers, as we know that these are the another agents which are suited for different type of condition like angina or post myocardial infarction cases, and they are also suited for coexisting anxiety or tachycardia, while they are also suited for non-obese high renin hypertensive patients. Beta adrenergic blockers, so they are also suited for pregnancy, so it can be used during pregnancy. While it can be avoided especially in case of congestive heart failure, bradycardia conduction defects, especially it can be avoided in asthmatic patients and as well as peripheral vascular resistance. And this drug beta adrenergic blockers, it can be avoided in especially in diabetic patients and the borderline glucose tolerance, while it can be also avoided especially in abnormal lipid profile, while it can be also avoided especially in case of patient to remain physically active. Diuretics is another group. As we know that diuretics, they are suited for the elderly patients, and especially they are recommended especially in the condition like when there is low renins hypertensive crisis, and as well as they are also recommended or suited for isolated systolic hypertensions. They are also suited for the obese with volume overload, while they are also suited for the renal disease with salt retention and especially in low cost therapy. Diuretics, for example, potassium sparing diuretics, hydrochlorothiazides, loop diuretics, so these drugs are avoided and young active hypertensive. They are also avoided especially in diabetes mellitus. This drug diuretics cannot be used in case of gouty arthritis whenever there is accumulation of excess quantity of, you can say, uric acid accumulation in the joints. As well as the diuretics, so there it can be avoided especially in case of when there is abnormal lipid profile, and diuretics, they are also avoided in pregnancy induced hypertension. In combination therapy, the drugs increasing renin activity like diuretics, vasodilators, and CCB, AC inhibitor drugs having low renin activity like beta blockers, clonidine, methyl dopa. Drug causing fluid retention, that is adrenergic blockers, except beta blocker. All these drug causing fluid retentions except the beta blockers. With diuretics, so it can be used in a combination with diuretics. Drug also causing tachycardia, hydralazines, and you can say diuretics, DHPS with non-selective beta blockers, and AC inhibitors, AT1 blockers with diuretics. Calcium channel blockers, they can be used in a combinations with the diuretics. Beta blockers, they can be used in a combination with prednisone. So this is the combination therapy. Combination to be avoided, especially in case of adrenergic blocker with clonidine. So adrenergic blocker, it cannot be recommended, cannot be used in a combination with clonidine. While hydralazines, especially, they are also avoided, especially in combination with prednisone. While verapamine and diltiazem, which are calcium channel blocker, so it cannot be given in a combination with the beta blocker. And methyl dopa or alpha methyl dopa, so it cannot be given in a combination with the clonidine. So this is very clear and simple thing. Now come to another topic, that is called hypertension in pregnancy. Especially as we have observed, many female candidates, they have pregnancy as well as they have hypertension. So then how you can manage this case? This is very easy to understand. Now the suitable drugs which are used in the treatment of hypertension whenever there is high blood pressure during pregnancy. So what are the drugs which are suitable you can use, especially in this condition? And there are certain drugs which must be avoided during especially pregnancy, hypertension during pregnancy. So the suitable drug, that is methyl dopa. So as we know that methyl dopa, they are also available in a market by trade, and methyl dopa, Aldumet. So methyl dopa, they are suitable. This is the most suitable drug. It can be used in pregnancy with hypertension. If a female, a patient, and she is suffering from hypertension as well as she is pregnant, so you can use methyl dopa. Hydralazine, this is also one of the suitable drug. So hydralazine, it can be also recommended for the pregnant females with hypertension. Dihydropyridines can be used, and you can say calcium channel blockers can be used. The cardioselective adrenergic blockers, atenolol, spandolol, and acylbutyolol, they can be also used. Prednisone can be used, they are also suitable drug. Clonidine can be also used, especially in hypertension and pregnancy. Now these are the drugs which must be avoided during pregnancy, especially whenever there is high blood pressures or hypertension in pregnancy. So these drugs can be avoided. So diuretics cannot be used, AC inhibitors cannot be used, calcium channel blockers can be used, while angiotensin converting enzyme EC inhibitors can be avoided. Reserpines, it cannot be used during pregnancy whenever there is high blood pressure. So especially in hypertension, whenever there is hypertension in pregnancy, so reserpine, they are also avoided. The non-selective beta blocker, they are also avoided here, while the sodium nitroprusside, they are also not recommended during hypertension in pregnancy. Now come here the sequence for ABCD method of drug sequencing. Now look at here the younger and the non-black, step 1A, and the older in black, step 1, so C or D. So it can be C or D. So they are in coupling form, while the step 2 is A plus C or D, and step 3 is A plus C plus D, and step 4 add alpha blocker or spironolactone or beta blocker. Now come here, look at here. Now let's suppose if a patient who is diabetic, so and diabetes, the first line therapy and the first line treatment, that is type 1 monotherapy. So in type 1, AC inhibitors can be recommended, especially an AT1 blocker, so angiotensins, converting angiotensin receptor blockers. It can be used in a combination with the beta blockers as well as calcium channel blockers, and thiazides as well as alpha blocker. They are used in type 1 diabetes mellitus. So first line therapy, so in first line therapy these drugs are used in monotherapy, AC inhibitors. while in type 2 diabetes mellitus, ACE inhibitor, angiotensin converting enzyme inhibitor are used, and AT1s, so angiotensin convertings, or you can say they are also used, while the calcium channel blockers, so they are also used in type 2 diabetes. Especially in renal disease, ACE inhibitors, angiotensin converting enzyme, they can be recommended, while the thiazide diuretic, they are not used in severe renal impairment. Instead, loop diuretics, they are used, hydrochlorothiazides and many more drugs. So inshallah, in my next lecture, I will continue my lectures, inshallah, from anti-angina drugs. There are drugs which are used in the treatment of angina. And thank you so much for watching my lecture. So if you have any question regarding my current lecture, so you can directly contact me through my WhatsApps. Thank you so much.